Federal government is recommending all Americans get COVID-19 booster shots to build their protection against the surging Delta variant. The CDC is calling for a third dose 8 months after the second Pfizer or Moderna shot. Extra doses are expected to roll out next month, pending the FDA's approval. Health officials say those who received the single-dose Johnson & Johnson vaccine will likely also need a booster, but they are waiting for more data on that. The decision comes as evidence shows the vaccine's effectiveness may decrease over time. The New York Times is reporting breakthrough infections account for at least 1 in 5 new cases in several states. Experts worry these infections could contribute to more vaccine hesitancy. During a press briefing this morning, CDC Director Dr. Rochelle Walensky pleaded with the public to get their shots.
We are currently averaging over 500 COVID-19 deaths per day, and these remain largely preventable. If you are still unvaccinated, please get vaccinated. The single best action you can take to protect yourself and others is to simply get vaccinated in the first place.
Arthur Caplan joins me now. He's a professor of bioethics at NYU. Professor Caplan, welcome. So the U.S., as you know, is recommending these boosters for Americans who received a 2-dose vaccine 8 or more months ago. The news comes despite the World Health Organization repeatedly asking wealthy nations to pause their booster campaigns and instead help vaccinate people in poor countries. What is your take on this? What is the correct ethical road to follow here?
Well, Tanya, it's a really tough ethics dilemma because if we don't vaccinate the rest of the world, we risk having all these new variants and strains that are easier to catch, may kill us more readily, popping up. So that has to be the long-term goal. But in the short term, I would argue our obligation in the U.S. is to take care of our citizens first. We have to help our neighbor, help the community, help people who are in our family, and that probably means boosters going here first. I would also say if we really tried to ship the booster supply overseas, it's still a drop in the bucket at this point, and I'm not sure a lot of these other nations are set up to distribute vaccine. They need it, but they need some infrastructure. So I hear what the WHO is saying. It's powerful, but I don't think it should stop us from trying boosters.
So, you know, as we mentioned, more breakthrough cases are being reported. How might these cases fuel further vaccine hesitancy and even misinformation?
Well, look, the vaccines are only 95% effective. Some people are going to get sick, get infected because it just didn't work for them. Their immune system might have been weak. There's also situations where some people may be losing immunity faster, which is why we're starting to talk about this booster situation. But no one should be complacent about vaccination, and no one should miss vaccination, because the crucial thing that vaccines do is they keep you out of the intensive care unit, they keep you out of the morgue. Even though there may be some infections that are breaking through, people who get them are not getting as sick and they're not dying. So you've got to get vaccinated.
So, you know, throughout the pandemic, Professor, there have been these reports of certain doctors promoting anti-vaccine theories, few and far between, but of course they get a lot of play in the anti-vax community. And you've said in the past that you think doctors who push these theories should lose their licenses. Can you expand on that?
Absolutely, Tanya. You're in a situation where we got a plague, we got 500 deaths a day. There's a possibility this could come back, and you've got a few, I think, immoral, unethical, irresponsible doctors out there spouting theories that, let's say, masks don't work, or they're dangerous, or vaccines don't help, or peddling alternative cures. I want the medical boards in every state to wake up, see what these people have said on social media, see what kind of communication patients say they've had with these folks, and make sure we yank their license. We cannot be, allowing misinformation that's deadly to come out of the mouths of people that are trusted sources.
Right. And so what about then those doctors who don't necessarily push anti-vaccine theories? You won't see videos of them circulating online, but they also don't necessarily encourage their patients to get inoculated.
Well, it's tough to go after them because you don't really have any strong evidence that they spread misinformation. But I'll say this, it's unprofessional as a physician at this point in time in this epidemic not to be stressing vaccination, not to urge masking, not to urge testing, that we get that more in place and more broadly used so we can isolate people who are positive. If you're not sending that message, maybe I can't come after your license, but I can sure condemn your professionalism.
And Professor, some people have declared their right to choose whether they get vaccinated or not, but federal officials are calling this the pandemic of the unvaccinated, insisting that unvaccinated people are the ones fueling these rising cases. So where is that line drawn between individual rights and the greater good for public health? Where do we draw that line? I mean, as Americans, we're obviously very concerned with individual rights, but at a certain point when a pandemic like this rages on and threatens to disrupt our entire society, does that line get drawn in favor of public health?
I'm going to say yes, Tanya, and here's the principle. First principle, don't kill people. Protect the immune suppressed. Protect children who can't be vaccinated. Worry about people who have cancer. Worry about people who got a transplant. They're going to die from this virus if you don't protect them because they can't be vaccinated. So the first principle is look out for your neighbor. Don't kill them. Let's act like a community. Let's be responsible to our neighbors. That limits somewhat our freedom. If you're not vaccinated, I'm not going to send the vaccine police out to your house to pin you down and get you vaccinated, but you shouldn't be wandering around. You shouldn't be out at the gym or restaurants or going to sporting events. You really have to take seriously in a plague community responsibility, limit your liberty by the fact that you can harm your neighbor, harm your family, harm your friends. Don't do that.
All right. Well, Professor Arthur Caplan, thank you so much. It was great discussing sort of the ethical side of all of this with you, which is something we don't often get a chance to do. Thank you.
Thanks so much.